Hello, welcome to Komen 101, a brief introduction to Susan G. Komen and Susan G. Komen Colorado. In the next few minutes, you'll learn about the history of the organization, the community impact in Komen Colorado's 25 years of operations, and where we currently need volunteer support. Breast cancer is the most common cancer among women in the U.S., accounting for 30% of newly diagnosed cancers in the U.S. The vision of Susan G. Komen is a world without breast cancer. We seek to accomplish this through a mission dedicated to saving lives by meeting the most critical needs in our communities and by investing in breakthrough research to prevent and cure breast cancer. We meet the most critical needs in our communities through our community grant program. The community grant program ensures access to care is available for those without insurance and for those who have insurance but still cannot afford the care. We also attend health fairs and community events to provide education about breast cancer risks and screening guidelines. Susan G. Komen started with a promise. In 1980, Nancy Brinker lost her sister, Susan G. Komen, to breast cancer. Before Susie passed away, Nancy made a promise that she would do everything in her power to ensure other families would not lose loved ones to this disease. 2 years later, Nancy founded Susan G. Komen as the first step to keeping that promise, a promise that is realized through the small steps Komen and its affiliates take every day. Susan G. Komen helps current generations by paying for breast cancer care and helps future generations by funding research labs to find cures for breast cancer. A pink ribbon represents the main office for each of the current 88 affiliates. Some affiliates cover an entire state or multiple states, and some affiliates cover one or several counties. In each case, local affiliates are responsible for understanding the local community's needs and creating educational, public policy, and grant programs to meet those unique needs. Komen Colorado became an affiliate in 2014 after two local affiliates in Aspen and Denver merged. In total, Susan G. Komen Colorado has been in operations for 25 years. In 2006, Komen Denver had the largest race for the cure in the country, bringing together more than 66,000 people to raise money in the fight against breast cancer. Komen Colorado currently serves 22 counties in Colorado. The main office is in Denver, as well as a staff member based in Glenwood Springs and volunteers throughout the 22 counties. The service area indicates where Komen Colorado can provide grant funding. A nonprofit organization that provides breast health or breast cancer care in the service area is eligible to receive grant funding. However, women and men who live outside of these counties may access Komen-funded services as long as they are able to receive care at a grant-funded facility within these 22 counties. In the 35 years since the founding of Susan G. Komen, a lot of progress has been made to reduce breast cancer deaths and improve the quality of care from screening through survivorship. However, we still have work to do. In 2017, the American Cancer Society estimates that almost 3,900 women will be diagnosed with breast cancer in Colorado. That's nearly 16% of all cancers diagnosed this year in the state. That's almost 10 women a day. Unfortunately, it is also estimated that 570 women will die from metastatic breast cancer this year, one woman every 15 hours. Colorado deserves better numbers, and volunteers are one of the key ways we can get to better outcomes. Along with the community grant program, Komen Colorado meets the most critical needs in our local communities from a holistic approach. To see the vision of a world without breast cancer realized, we must fight breast cancer on all fronts. The ways we fight breast cancer include ensuring public policies allow all Coloradans to obtain affordable, high-quality medical care to prevent, detect, and treat breast cancer. It also includes educating our community members about myths and misconceptions around breast cancer, and by working with partner organizations to ensure efforts are amplified and not duplicated. Every year, Komen Colorado reinvests 75% of funds raised through Race for the Cure and other fundraising efforts right back into Colorado. Since 1991, you can see the impact local grants have had for more than 200,000 Coloradans. In total, Komen Colorado has invested more than $42 million back into Colorado. Through our fundraising efforts, Komen Colorado also invests 25% in Komen Global Breast Cancer Research, totaling $15 million over the last 25 years. The majority of our fundraising efforts take place at 3 signature events: Pink Tie Affair, an inspiring gala in Denver; Snowshoe for the Cure, a fun, energetic event in Frisco; and Race for the Cure, our annual 5K event in September that brings together a community of fighters, survivors, and loved ones in the fight against breast cancer. We also receive funds for the fight against breast cancer from several independent third-party events. These fundraisers bring additional support from across the service area. As a small nonprofit organization, we need support in many operational and programmatic areas. This is just a snapshot of where and how we need volunteer help. After watching this video, you will be asked to answer a few questions about the content of this webinar and to indicate your volunteer interests. Komen Colorado will follow up based on your interest to explain next steps, as several volunteer roles require more in-depth training. Thank you again for joining in the fight to end breast cancer. You will now be directed to complete a brief survey to test your knowledge and to share your interests. Komen Colorado will follow up in 1 to 2 weeks to discuss next steps. In the meantime, please contact Komen Colorado with any questions you may have. Thank you for being more than pink.